Introduction. What is COVID-19? Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, and fatigue. Other symptoms that are less common and may affect some patients include loss of taste or smell, nasal congestion, conjunctivitis, also known as red eyes, sore throat, headache, muscle or joint pain, different types of skin rash, nausea or vomiting, diarrhea, chills, or dizziness.
Great question. There is really no way to differentiate. You should get tested for both. There's a rapid test for flu and there's a rapid test for coronavirus. You should Google COVID tests near me today. And so you know where to go. God forbid that happens. But treatment for COVID and influenza is very different. Their prognosis is very different. So I think anytime if you start developing symptoms, you should get tested.
Protect yourself and others from COVID-19. If COVID-19 is spreading in your community, stay safe by taking some simple precautions, such as physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning your hands, coughing into a bent elbow or tissue. Check local advice where you live and work, do it all. Here are the basics of how to wear a mask. Clean your hands before you put your mask on, as well as before and after you take it off, and after you touch it anytime. Make sure it covers both your nose, mouth, and chin. When you take off a mask, store it in a clean plastic bag, and every day either wash it off if it's a fabric mask or dispose of a medical mask in a trash bin. Don't use masks with valves. How does COVID-19 spread? The COVID-19 Virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. What are the preventions? The best way to prevent and slow down a transmission is to be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face.
Does wearing a mask, washing hands, and maintaining social distancing guarantee 100% protection? Once again, there's no such thing as 100%, but it guarantees a very good level of protection.
Getting back to normal.
Realistically speaking, when will our life go back to pre-pandemic status? Will it ever be so? And if not, what precautionary measures should we be taking even after getting vaccinated? So after 9/11, you all know so much changed in air travel. We went back to normal, but it was a new normal. I think it's going to be a new normal. But expect 2021 to be a year of caution, a year of face masks. And this is why I said my earlier comments, this is a long game. You don't want to go all crazy and allow this virus to paralyze you. There are two extremes. Don't go to the extreme where people are saying, I don't need a mask, I don't need anything because this is all hocus pocus. And the other extreme is you just have to isolate yourself in the house and don't even go outside or you will get COVID. Both of those extremes are scientifically inaccurate. Next question, when will the vaccine be available for the general public? Can one register ahead of time to be vaccinated? The likelihood of vaccine being approved before the end of this year, during this month, is very, very high. Chances are the Pfizer and Moderna vaccine that are going in front of FDA on the 10th and 17th of this month, they will likely be approved. There is no way to pre-register, stand in the line. The vaccines are going to be allocated based on risk, likely frontline workers first, and then nursing homes. And from there on, it's going to be tiered, but you cannot pre-register.